At UNC, we have a comprehensive palliative care program, so we are working every day to impact the lives of patients and families, one person at a time.
For me, it's really an honor and a privilege to get to know who people really are as a human being at a time when they're particularly vulnerable. I think we can be an extra layer of support within a healthcare system that can be really complex and often overwhelming.
Our main goal is to try to elevate the patient's voice, their values, and make sure that we're honoring what's most important to them as they kind of follow through this journey of their illness.
My first interest in medicine was oncology, actually. I went to medical school purposely to become an oncologist. I walked in a room with an attendant and he had to deliver some bad news to this very young guy that he had testicular cancer. And I'm looking at the patient, and this guy, you could tell his mind is miles away, right? What does this cancer mean for him? Is he gonna have kids? Is he gonna die? Is he gonna come back? Like all this stuff going through his head. But the oncologist just kept talking about, well, we could do this, and you need to have surgery. I was more interested in how is this person processing all of this? Where does this fit in this 25-year-old's grand plan for life? I started becoming more interested in those conversations. This kid is so much more than just his testicular cancer. The deeper conversations were more fulfilling for me.
Our exposure often at a medical school or residency level of training can be pretty limited. It often just is from the context of like inpatient palliative care consults. It's rare that people have a lot of experience clinically with what our group does otherwise. We really do sort of tailor it to the individual. So that allows us to get to know the fellow, really understand what they're hoping for out of their career, and helping to tailor the experiences to kind of maximize what it's like to help them achieve those next steps.
One of the really nice things about the UNC program is there is such a focus on kind of the self-care and camaraderie. Especially for the fellows, we really focus on helping them build the skills to stay in the field for the long term.
One of the neat things about palliative care is how much it recognizes everybody's strength and contribution to the team. I think all of medicine is interdisciplinary, but there's something unique about palliative care in understanding that all of these pieces and parts are needed to really care for a patient holistically and well.
We have such a wonderful group of people to work with, and I love coming to work every day because of the people that I get to interact with.
I think all of medicine is dealing with burnout, and especially in this work, you're seeing a lot of distressed people day in, day out. And so how do you kind of compartmentalize or figure out a way to process that so you're not just taking it home and feeling the weight every day? The fellows each year have a few social events throughout, and then they also have a self-care curriculum where each month they get together and focus on something kind of just outside of medicine.
So today we're out curling with all the people. We came, did a little curling experience, and we're ready for the Olympics at this point.
Yeah.
This is Paul. You're like the king of organizing events.
I think it's pretty cool that 20 plus people from our program decided to come out on the ice and curl, make fools of themselves, have a great time. It's a great time, so love that about our group here.
You know, I think the work that we do is really hard day in and day out, and so we just look for releases in different ways. And so I think we, as a group, we get along really well. Definitely value good times and laughter and in the hard work we do. And so, you know, coming out and curling. We don't always curl.
We don't always curl, but yes.
We do other things too.
It's always fun.
The Alzheimer's disease-related dementia palliative care research study. It's a multi-site study. The principal investigator is Dr. Laura Hansen, who's here at UNC, and Candace and I are two of the clinicians from UNC who are involved in the study. We are working with a patient who has a diagnosis of dementia. We consult on them as we would any other patient on our consult service, and then we take things a step further and really focus on transitional care. How is this caregiver coping? What is their plan going to be when they leave the hospital? How can we not only prepare them the best we can for what is to come with the trajectory of dementia, and how can we support the caregiver in the process?
The adjective that people use to describe UNC's medical campus more than any other adjective is collaborative. And that makes a tremendous difference when you're trying to get a research project done, because you need those people to be able to come together, share their knowledge, and work together collaboratively to get a project accomplished. And this is a place where that's easy to do. Can't do it alone. You can't sit in a laboratory or sit behind a computer and do it just by yourself. So from the very beginning, when you start to develop an idea, you're going to be talking to potential team members. You're going to be testing the idea, asking, does this make any sense to you? Do you think we could do this? You build those ideas into a research proposal, and when that proposal gets approved and funded, then you move into the fun part of actually delivering on it.
Our home team is about 60 to 70 patients, and then we have an inpatient unit down in Pittsboro. And so our inpatient unit is 10 beds, every room is private, and they each have like a private patio. It's 15 miles from the hospital. It's like a private environment back in some woods. And that in itself just lends to like a very peaceful environment. And so within a hospice, I mean, there's a lot of families there. It's very focused on creating both a home-like environment and somewhere that's very quiet and peaceful. And so I think for fellows, we've heard consistently, they enjoy going down there because you do have that sense of you're getting away from the hustle and bustle of the hospital, and you're just in this kind of natural retreat where you can spend time sitting with patients.
In order to do this type of work, we really have to take a holistic approach to ourselves. And we, I think, really emphasize that in our fellowship training, that it is not just about who you are as a physician, but it's about who you are as a person. It's important to kind of have a pediatrics track within an adult fellowship. We have a wonderful inpatient pediatric team, of which I am lucky enough to be able to rotate with. And then we have a great partnership with one of the community-based palliative care and hospice programs with their kids team. It's pretty rare to have an opportunity to liaise and have that experience, and so together between sort of the academic experience you get here at UNC and with our partnership with the community-based team, to have really robust opportunities to kind of engage with inpatient and outpatient pediatric hospice and palliative care.
On our inpatient palliative care service, we meet every morning as a team and talk about how we can best care for the patient and see how we can best meet the needs of that particular patient who is facing a serious and/or life-threatening illness.
The relationships that you get to build with these families and patients, when they look at you often and say, this is the worst day of my life, and you have the privilege to be there and maybe make it a tiny bit less painful. And that feedback from the families and from the patients to say, thank you for letting me tell my loved one's story. Thank you for caring about them, not just as a patient in bed, but as a person, and understanding what's important to us. You're the only one that's done that, or that means so much to me when I know things are going really bad. It gives you so much positive feedback in the sense of like, we can help someone during the worst day of their life.
The palliative care program is only as successful as the health and well-being of the people who use their skills to take care of our patients. And I know that the program's headed in the right direction because the people themselves are doing well.